Hello and welcome to Thunder Bay Regional Health Sciences Center's situation report for our COVID-19 response. My name is Tracie Smith, and today I'm here with Laurena Penasie. And Laurena, you work in laundry here at Thunder Bay Regional Health Sciences Center. Welcome, and thank you so much for joining me today.
Thank you for having me.
You play a really key role in the circle of patient care delivery here, right? Laundry services are integral. Can you tell us about your role at the hospital and maybe what a normal average day was like before COVID-19?
We always did have a busy role in the laundry department. Since the COVID, we've gotten numerous scrubs for other departments that got donated to us. So ICU's got some. 3A when 3A was open, due to the COVID, they were given a number of scrubs that we had to stamp by size, then deliver, which did take quite a bit of time. We also had to deliver these to all these different areas. After that happened, probably a good maybe, I'm going to say a month and a half, 2 months later, we started to get the outside gowns. Some are yellow, some are blue, and those go to different areas. We did have to stamp them with a date when we received them and distribute them to the floors.
So those are all materials that are over and above the laundry that you were doing before.
What we do, yes. So at first we were challenged to do all this work with our little group. Then our management looked into it and we got another staff member to cover and give us a hand with taking over doing the gowns and giving us a hand on our scrubs, which really, really helps out.
So a lot of those materials were being used in hot zones, right? COVID-19 specific areas,
Correct.
The dedicated unit, the ICU, emergency department. So what new risks did this introduce to you and staff in the laundry department?
Well, they stopped us from going in and out of the emerge department. We weren't allotted to go into the 3A, which was great. I mean, we were delivering them to a different section than those doctors, nurses, caregivers would go and retrieve these scrubs and whatnot from these areas that we would drop them off and take them back to their own departments or change wherever their allotted spot was. So ourselves in the laundry department, we would deliver them to the areas. We'll use emerge for an example. We would take the scrubs up and just kind of throw them into one of the side doors. Then their staff would take care of them and put them by sizes and whatnot on their shelves.
Okay, so these were different precautions and processes
Correct.
Put in place to protect the
Correct.
laundry staff.
Yes, apparently I haven't used the gown myself. I did try one on, and yes, they're pretty warm. So, kudos to those staff that have to wear these all day.
Yes, absolutely.
They do change them for every patient, and I'm assuming they change them when they leave a patient, then go back later on, because I mean it's a dirty gown, and so we do have thousands of these gowns that are being washed daily and distributed back out.
Wow, so
yes.
Extraordinary volumes.
Very much so, very much so.
And what about in the laundry department itself? What processes are in place to make sure that staff are protected from the dirty laundry?
Well, we are separate. The clean side is first it gets processed from they call it the dirty side, which is where our washers are, and they are in gowns, so they're protected. They've got their masks on and their gowns, so they're protected. Once that gets processed through the dryer, then the clean side, which I'm on, we dump it, and then it's divided all up, and we have a certain number, which is number 9. She counts out 25, I want to say, per bag, and then they get put onto a cart, and then we kind of distribute them out.
It's great. And
It's a long process, yeah. It's a whole day for that number 9 person.
wow,
Yeah,
very busy.
yeah, very busy.
And how did you feel coming into work during this time? Did you feel safe, nervous?
You know what? At first I was a little nervous, but being here for the amount of years that I've been here and knowing the precautions that the hospital takes and myself take, and to protect everybody else out in the public. Okay, the first day, yeah, I was scared, a little nervous. It's a little, wow, everybody's in these different scrubs and gowns, and everybody has to wear masks, and it was a little nerve-wracking. But once you started talking to management and seeing that everybody was doing it, I started to calm down. It probably took maybe a day or two, but I enjoy being here. I really enjoy being a part of the regional.
Oh, we're
Yeah.
so lucky to have you
I
here.
enjoy it, yes, thank you.
How has the experience been for the team that you work with? Has it changed anything?
You know what, I think we've come to, we're a little more relaxed. It was overwhelming, knowing the numbers that we were getting. Oh, here comes another 5,000 gallons. Here comes another 5,000 gallons. So it was a little overwhelming, yeah. I mean, a little stressful. Oh no, what are we going to walk into today? But they're a good team. The team is really good. They kind of work together really well. And if someone's got nothing to do, they kind of pick up the slack and go give the person with the scrubs maybe a hand. And you know, there's so much other things. I mean, we can't stop our other roles. As in blankets and the spreads and all that stuff that has to be done. We have to keep going with that. So, but they're a good team. They're a really good team in there.
Oh, that's fantastic.
Yeah.
Hey, you spend a lot of time wearing a mask every day.
I do. I have my mask right
Absolutely,
here.
of course.
It's just not on for this speech here.
How do you find that, wearing the mask all day?
It's a little warm. It's a little warm some days, and I do want to cheat and yank it down, and I'm getting used to it a lot more, where I'll leave it on, and when I notice that I'm in the hallway by myself, and I'll kind of yank it out and get that extra breather, and then, of course, I put it back on when I'm close to somebody.
Yeah.
And I always say to everybody, I'm protecting you, and you're protecting me, so let's just take a roll and be there for one another.
That is a great
Right?
message. Well, I think we'll end it with that wonderful message.
Awesome.
Let's be there for each other.
Yes.
Laurena, thank you so much. You are one of the many frontline heroes
Thank you
in
very much.
healthcare. You never stopped coming to work.
I do. I love being here.
Absolutely, and we love having you here. So thank you for taking the time today. Thank you for everything you and your team have done throughout our COVID-19 pandemic. Keep up the great work.
Thank you.
We'll see you again soon.